Hello there. I'm here to help you try to solve some of your neck and shoulder issues before massage therapists are allowed to open again. So I've had lots of requests from people who've been working at computers. Their shoulders are hunched forwards because they're working at home. They're not in ideal conditions. So I thought I'd try this online method and give you an idea of what to do yourself before you can come for a professional massage. So let's start with a basic neck massage, and then we'll go on to pinpointing the pain and seeing what we can do about that. So first of all, you're going to take your knuckles and you're going to start under this bone here, which is under the ear. Put your knuckles just underneath that bone, and we're going to go down really slowly with a pressure that feels good to you. We haven't got any oil or any cream on our fingers because the skin moves a little better without that. Oil and cream make your skin very slippery. So we're going really slowly down here, all the way down to the bottom of your neck. Then go back up again. We're going a little bit further behind now. Going back up, same idea. Push with as much pressure as you feel is comfortable for your neck. All the way down to the base. One more time, a little bit further back again. So your knuckles are just under that ridge behind your head. And down we go. Nice and slowly. Nice even pressure through your knuckles, not too hard, it mustn't hurt you. Ah, it's nice. Okay, so we're going to do that again, one more time. Start under that bone, under your ear, and down we go. A little bit further back. Give it some nice pressure. You don't want to hurt yourself, but enough to move the skin under your fingers. And one more time right at the back. Okay, how does that feel? Now, can you feel the difference between the two sides of your neck? Does this one feel a bit longer now? Get lopsided. Okay, so we'll do the same to the other side. Under that bone. And down we go. Nice and slowly. Of course, if you have a willing partner just lying around on the sofa, you could always ask them to do it for you. That's always an option. Okay, further back. Nice and slowly. Good pressure on there. Don't forget to put a little bit of pressure on. Okay, and once more, a bit further back. Okay, start again. Under that bone under your ear. A bit further back. And back once again to right behind, underneath the thick bone of your skull, the back of your neck. Now you should feel a bit lighter. Your neck will feel a little bit longer, a little bit more flexible, a little bit lighter. Now you're going to put your fingers together on your spine behind your neck, just under your hairline, and you're going to put some pressure on your neck and pull your hands out to the sides. So you're pulling the skin of your neck out to the sides, just underneath your head. Okay, and go down a little bit lower and do exactly the same thing. A bit of pressure on both sides, pull out equally on each side. And lower again. Okay, start at the top again. Off we go for the second run. A nice pressure, the same as the other one. Give it a nice pressure so it feels good to you. A little bit lower. And a bit lower still. There, excellent. Now, you probably have a pain in your neck when you turn to the side, or when you look down, or when it's a combination movement, as you're looking down him and you're looking down, you're looking sideways. So we're going to see if we can address those pains. So the first thing we're going to do is think, okay, where do I feel the pain? Let me do a movement that I can pinpoint where the pain is. So maybe it's when I look over this shoulder. Oh, there's a pain there. And I can feel that pain. I can put my finger on the pain. So we put our fingers on that pain. Keep your head still and keep your head to the front. So we're going to rub around that rough area. We're going to rub it around with our dry fingers on the bare skin, not oil, not cream. And we're going to see if we can bring some blood into that area. We're just going to warm it up with a few hand movements. So put your finger back on that place. If you don't know where it is, do the movement, find the pain, push your finger on that place. Push your finger on that place so that the pain is around 5 or 6 out of 10. So it hurts, but not excruciatingly. So we're going to push on that place for 20 or 30 seconds. If the pain gets worse after 20 seconds, stop pushing. Normally you will find that the pain starts to dissipate after 10, 20, 30 seconds. It'll start to reduce. In fact, you might not even feel it anymore. So you can push a little bit harder. Think, okay. So you've got your finger on that pain, and now it's started to dissipate. So what we're going to do is continue with the pressure on this finger, straight on the place where it hurts, and we're going to do the movement that causes the pain. Slowly to the side and slowly back. We can go to 45 degrees and then we can look down, and then we can come back up slowly, and then we'll come back to the front. You may need to do this 3 or 4 times. Look down, look up, come back again to the front. But that's the essential basis of ridding yourself or reducing your neck pain. Is finding a point. Where does it hurt? Warm that point up with some frictions from your fingers on that area. Get some blood going to that area. Give it a bit of a massage. And then do a movement that causes the pain. Do the movement slowly and keep pressure on that area where it hurts. You should find that it will diminish reasonably rapidly. Also, you can grab hold of your bare skin with that kind of pincer grip of your fingers. So you can grab the tissue there and you can pinch it and you can rub it, squeeze it and pinch it. with that pincer grip, and you'll find it hurts, but it's a nice hurt. It feels good when you're finished hurt. So that's another thing you can do. The other muscles that sometimes get very tense are these muscles down here. They go from up in this area right down to your collarbone. So if you stick your head forward, you can see them. So what you can do is the muscle starts up here. You can grab that muscle because you can feel it, and you can go around in small circles all the way down the muscle, all the way down, all the way down, all the way down to your collarbone. So you can feel that it's quite a thick muscle. It goes all the way from underneath your ear here, all the way down to your collarbone. So both sides, you can give that a massage. If you feel a sore point in this muscle, you can just keep your thumb on it, or your finger, depending on which side it is. Just rub it round and round. After you've gone up and down and you've warmed it up a couple of times, go back to that sore point, put a little bit of pressure on the sore point, and just circle your thumb or your finger on that sore point, and normally the pain will dissipate. If it hurts more, then stop. You need to see somebody who's qualified to look after it then. Okay, so now you've found all the sore spots, and you've massaged them, and you've prodded them, and you've put pressure on them, and you've turned, and the pressure has now diminished. You can do some stretching. Your head pivots around this point here, which is under your ear. It's that bone where we started off the session. Your head pivots around there. So when you're nodding your head and we're doing a stretch, we try to pivot around this point, which means that you don't crane your head right back. You're not cinching all the muscles behind your neck because you're not craning your head right back like that. So we do yes and no with our heads pivoting around this point. And then we can do no, left to right, and back to the center. Then you're going to put your arms behind your back. Just leave them behind your back. And then we're going to lift our ears up to the ceiling, sideways movement of your head. Lift your ear up to the ceiling, keeping your shoulder down. We'll do each of these movements about 3 or 4 times, depending on what feels good for you. You can change it depending on what you like. Okay, finish off with some rolls of the shoulder. You can roll your shoulders backwards, you can roll your shoulders forwards, and then we'll do some shrugs. So pull your shoulders right up to the ceiling as hard as you can go and let them drop. Don't lower them gently, just let them drop. And again, and let them drop. And the last time. So now your neck and shoulders should feel a bit better than they did before, and should get you through to when we're allowed to start massaging you again. So I should be back at work on the 12th of April, if the government doesn't change its mind again. And you can book a massage from now, because as far as we know, they're the guidelines. So I'll see you then. Thank you for watching.